Now, raising my voice. To mark World Mental Health Day, this week's essays are personal and candid reflections from working artists who have mental health problems. This evening's speaker is a writer who's just had his first novel published.
I'm Chris Daines. I'm a writer and a manic depressive. It's really quite difficult to talk about having a mental illness like mine. Even with the wonderful Stephen Fry on our side, there's still an awful lot of people who are profoundly uneasy about hearing about it. Of course, we've come on quite a bit since the 20th century. We don't get called that old-fashioned word lunatics, or even mental patients anymore. The present trend is to talk about us as service users of our local mental health trusts, and they give us nice airy surroundings, or provide home care, rather than locking us up in old workhouses. It must have been truly terrible in those days. But I don't think the new cuddly mental health service message has really filtered down to a lot of people yet. When I do talks about my illness in some places, it feels like doing a striptease in the middle of Piccadilly Circus, with the audience thinking I look like Quasimodo, and moreover, quite likely to attack them, because of course everybody knows deep down that people like me are dangerous and horrible. If you've got bipolar disorder, or manic depressive illness as it's called, as I do, half the time you're quite likely to think that the audience is right, and the Quasimodo thing and the horrible thing is a pretty fair assessment. However, I feel a bit reassured in talking to you that you're gentle and well-educated listeners to Radio 3 and aren't going to think nasty stuff like that as I try to discuss how manic depression has informed my writing. I was interested to see the statistics recently about deaths during high-speed chases in police cars, and it struck me that looking at the figures, you've got far more chance of ending your days under one of them than you have of being hacked to death with an axe by someone like me. It makes you wonder who society should be really looking out for. Maybe the tabloids have a good deal to answer for in the way mental health is often seen. We all remember the Sun's bonkers Bruno. I'm rather in favour of a bit of mental illness. Of course, it can be a horrible and painful thing, and even a terminal one like cancer, and I've had cancer too. But unless you're really unlucky and kill yourself or end up locked away for ages, you can learn to live with madness, and I think it produces some really splendid stuff. I've no doubt that every form of suffering does that in one way or another, perhaps because suffering is something we can't avoid, so we might as well make use of it. People who work in hospices, for example, often say they're immensely impressed by the serenity of many patients as they face the end of their lives. That may be an example of what I'm talking about, of how suffering can enrich our personal journey and the journeys of others, even at the very end. If you like, that's the gift for some people and their families inherent in terminal disease. So, if I'm right, and suffering can bring benefits even at the end of life, then what special growth does mental illness do for us? From my own experience, and knowing a few other patients like me, I think I'd say that the tensions and desperately agonizing attempts to work out what's going on inside you if you're mad produce extraordinary things which often express themselves in the arts and sciences as you try to struggle it all out. In my own life, the endless seesaw of being bipolar has produced a dialectic which I feel compelled to resolve with the tools I have to hand. I'm not much good at anything else, so I have to write. I'm in terribly good company, though. Aristotle said that no really clever person has ever existed without being a bit round the bend. Not that I'm in any way claiming to be one of his geniuses. Nobody who's tasted my omelettes, for instance, would think that. But I'm cheered by Byron saying that most of us poets are mad. His brilliant and hilarious verse, combined with his very bizarre behaviour, always strikes a chord with me, and in some mysterious and unsettling way I find myself identifying with him. I'm quite certain he was off his trolley. So, my thing's writing. I lamely try to step in the footprints of such famous nutters as Gogol, and even poor Hemingway, who shot himself, and whose ancestral tree was chock full of depressives. I write because I can't draw like my mum, or mess about on pianos or on the stage as my comparatively sane brothers can. If I try to draw anything, it looks like that thing that used to happen when your spirograph started whizzing off the paper when you were a kid. I was quite good at writing even as a small child. The illness didn't bring it on like some enforced and dramatic change, although by the time I'd reached adolescence it had certainly started making a difference to its substance. One of my earliest memories was of being sent to the headmaster's office in primary school. I was nervous because the only time I'd been in there before was when I'd sloshed my mate Andy Blackwell in the playground and made his nose bleed. Even now I feel the injustice, because I honestly only meant to give him a tap. Mr. Davis had threatened me then with his never-used cane, which used to be propped up beside a case of frightening books that looked as though they had no pictures in them. So, when I went to see him the next time, I was surprised at his apparent enthusiasm over my story about a storm which had blown our imaginary apple tree down and made the lightning flash around the bedroom like a ghost, although, like all of us at that age, I put the H in the wrong place. I was particularly taken aback because I'd done a really daft picture with apples looking like lollipops, but I got an enormous number of gold stars to show to my mum and dad when they were next free from looking after my baby twin brothers and the demands of a large parish community. There's a genetic predisposition to my kind of madness, but it seems that the switch is often turned on by some sort of trauma, sometimes a very early one. My story isn't very original, I'm afraid. A chap in the church, where I was a very young chorister, seemed to fall in the kind of love with me which in his mind an 8-year-old was capable of reciprocating physically and willingly. I think now that perhaps he saw some kind of loneliness or vulnerability which he found attractive in me, and that made him want to come on to me, perhaps because I was the middle child in a large family. As for the other things that can set it off, my psychiatrist tells me that childbirth can do it. After I'd reached puberty, this guy dumped me for somebody younger. My academic progress after primary school was very largely based on my ability to write. I ignored and feared the scary factual sciences and waffled my way through comprehensive school at Oxford, where indeed one of my tutors said of an essay of mine, which I thought was a spectacular literary display of Baroque argument, although in truth a little thin on actual knowledge, "Even you, Christopher, cannot make bricks out of straws such as these." By a miracle of charlatanry, however, I managed to get a quite decent degree, and he was made to eat his words at a celebratory dinner, so sucks to him. Writing's always kept me going. It gives me something to do and's helped me through the sad times when I'm suicidal. The medication also helps a great deal. Actually, a great friend of mine in the sciences, who's swanky enough to hold a professorial chair, said to me that, rather in the same way, when he was profoundly depressed and wanted to kill himself, the pressure of work made him carry on, as though research was somehow able to fill his brain up and give him a way out from the very dangerous blues. I have great affection and enormous respect for him, and he's really hot at sums. Thinking about it, I suppose my manic depression has informed my adult writing in a couple of important ways. The dialectic I've already spoken about comes in the contrast between the despair and the extraordinary heights of the disease, producing a kind of absolute imperative or a restlessness to come to some sort of personal synthesis in intellectual and artistic integrity. And rather excitingly, the manic phases of the illness provide huge bursts of energy in which I can stay up all night and write all the way past dawn into the next day, rushing ideas, some good, some bad, sparking off like fireworks in my head. It's rather good fun for me, less so perhaps for my poor wife Ruth, who has to put up with the downstairs lights being on and the eternal tapping of the keyboard. They always say, after all, that depression is hell for you and mania is hell for your family. As for the depressive stuff, Unless I'm really bad and curled up weeping in a fetal position, I can usually do some editing where I cut out in solitude the rubbish, and with luck I'm left with something decent enough to send to a publisher. Of course, the downtimes are the other side of the mania. If you've been whizzing about like a Duracell bunny on speed, you're bound to crash at some point, and we more than most. The trick is to make use of it if you can, although I admit there have been times when I have wasted huge amounts of potential working time because of the disease. Of course, I take medication. They're basically mood stabilizers which allow me to live something like a normal life and keep me out of hospital. Before I had them, my particular speciality was smashing up the furniture, going through in the space of a few weeks 3 wooden chairs, a not very elegant coffee table, and a rather good Victorian chest of drawers. Taking the medication, which I do under the watchful eye of Ruth, is only like having to be on insulin if you're a diabetic, and I'm quite content to be on them for the foreseeable future. I get very cheesed off with the pull-yourself-together crowd who've never experienced a real illness in their lives and tell you they don't hold with taking pills. Personally, I thank heaven for the meds, and I'm very happy admitting that I've got a huge amount to be grateful for to my prescribing doctor and my wonderful community psychiatric nurse. Not to speak, of course, of the NHS and Denoir and Bevan, although I do have trouble eating, so let's not let any of them off too lightly. As far as the other practicalities of being a writer go, sometimes they don't help. It's not worth whinging about them too much, because all art surely involves a certain risk, a putting of yourself on the line and saying, "Here am I, how's this?" Even people in the arts who aren't mad, although I'm seriously beginning to wonder if such people actually exist. For a manic depressive, though, when things go badly, it can be a real blow to one's self-esteem and lead to serious dangers you just have to be willing to accept. Certainly, it can be a real trigger to set me off again. Just as an example, the long delays and nerve-wracking anticipation of waiting for publishers and agents to make a response to carefully constructed but secretly angst-ridden submissions and phone calls is of course well known to cause even the most sane of scribblers to go a bit wobbly. Has a ludicrous effect on me. I think my nurse is the most well-informed person about the progress of my books, apart from Ruthie. There's a bit of a temptation to write about all of that, of course, although I suppose I would have difficulty in getting it published, so it might be a waste of time. So, would I be without the whole thing? I honestly don't know. I've had it so long that you might as well ask, would I like to be a grasshopper? Looking at a bit of literary history, though, and the people I know and love very much in my bipolar support group, I'm absolutely certain that writing and society in general needs mad people. In madness you plumb the depths of human experience and sometimes the heights as well. It honestly does take a nutter, after all, to lie on his back for years painting a ceiling like Michelangelo, and on the whole I think our world has been enriched through him. With my Catholic tradition, it reminds me of the Christian redemption story, in which the shit of the stable floor is surrounded by the rustle of angels' wings.
Tonight's essayist was Chris Daines. Tomorrow you can hear the experience of filmmaker and installation artist Monica Dutter. BBC Radio 3, 90 to 93 FM and on digital radio. And now, a little later than usual, Late